Good morning again, everybody. Welcome back to the room. It is Wednesday, October 30th, final Wednesday in October. And of course, we are just so happy to be here once again. Compliments or friends at Beacon Insurance and Western Union. Thank you for making the show possible. Truly appreciate you. And to everyone who joined me daily, thank you so much. Appreciate you as well. You will be joined momentarily by the Honorable Delma Thomas, Minister for Mental Health, Wellness and Religious Affairs, with a special focus on the Mongay Psychiatric Hospital. Before we get to that, though, I just want to preempt this a bit because, we talk a lot about mental health and all of that, right? We probably know of someone, we see people displaying signs of mental illness. And sometimes you don't necessarily have to display it because I said lately people are good at masking, but everybody goes through stuff at some point in time. Everybody at some point in time, your mental health can be challenged. We're dealing with life, we're dealing with moods, dealing with, just about everything. Life sometimes. And sometimes your state of mind and how you feel is disconnected from, what's happening in your everyday life. Emotions, children, and it can happen to anyone, adults, teens, children. Everybody can experience it at some point in time. Some might be more severe, some might be manageable, controllable, etc. Depression, bipolar disorder, different mood disorders. A lot of things can, a lot of symptoms can link to mental health, and you might find yourself having sleep problems. You might find yourself having thoughts of suicide. Your energy is low. You feel worthless. There's decreased interest in things you used to enjoy. There's a number of symptoms that can, challenge that can let you know that you're having difficulties, whether it's mental health challenges or mood disorders or whatever the case might be. And from a government perspective, of course, Honorable Thomas, plus youth development. I'm sure you've seen a number of youth engagement happening, and I'm quite interested in that. Let me just get you guys on here first, and then we jump right into it. Come on in the room. Good morning, Shanti. Thank you so much for sharing as always. Thank you so much, Marianne. Who else is here? Good morning, Jenalyn. Good morning, Jackie. Jackie, come and behave yourself today, all right? I thank you. Morning, Nakisha. Hey, Judy. Good morning. Where is Akeem? And Akeem is the minister of all the ministries. It is under anything to do with government. So make sure Akeem is here this morning. Good morning, Roxanne. Good morning, Lydia James. Who else is here with us? Richie, good morning. Della Fletcher, good morning to you. Neilon Lewis, welcome. Shireen, Kathy, good morning. Terry, good to have you here. Sherry Ann, Jillian, welcome. Good morning, Wendy, Samuel, Tandy, I see you. Good morning, Marcus. Clarina, good morning, beautiful. I just want to applaud you as well on your initiative, because it's something that we take lightly, but it's something that really, really needs that sort of support, providing sanitary napkins, etc. to schools. It's a good initiative. So I want to big you up on that. Good morning, G-Eds. Ann Fletcher, good morning. Where is Maureen? Good morning, Sonia. Good morning, Terrence. Good morning. No, you're not late. I'm just waiting for more of you to come in the room, so I'm making up time, and then we'll start. We already have the minister backstage, so we're going to bring her to the forefront shortly. Andrea, where is Andrea? Morning, Naya. Naya, you and Jackie, I'm going to need you all to be on your best behavior. Good morning, Kata, Petlin, good morning. And of course, all listeners via radio, good morning. And if you're listening to me online via our website or on our stream, any of the streaming platforms, thank you so much for being here this morning. And another thing too, before we jump into the conversation, right? And I'm happy that I have the minister here because, sometimes things happen. And again, we get all up in our feelings. And just like the conversation we were having about the lady who tried to take her life on Sunday on live, who consumed what seemed to be different types of pills and on a live with hundreds of people And she basically said she was giving up and all of that. um, I always have to remind us that we are not all wired the same way. As much as you'd like to think that everybody's the same, we are not. And yesterday there was this video going around of this young lady in Karakou, and just looking at it, we have to realize that a lot of the times, it's as much as it is to do with politics. Sometimes you have to sometimes put yourself on people's level. What you might think might be an easy answer or an easy fix to another person's is not, especially when they're not there, whether education, whether you know what I mean. Sometimes you just have to look at it from that perspective, and people often take advantage of those kinds of people. So what we need to do now, instead of joining and bashing and pulling and tugging, is to lend support so that they be able to see things from a different perspective and not through the lenses that they probably think works for them. It's not necessarily, everything doesn't have to do with politics all the time. Sometimes we just have to remove ourselves from the equation, and remove the politics from the equation and just see people for who they are. Everybody's not up there. Everybody don't think the same, everybody don't see things the same way. So you have to give people grace, and I think that's what we're lacking a lot these days. We lack empathy and we lack grace. We're always busy to pounce, we're always busy to attack, we're always busy to belittle people, make people feel small, make people look bad, when it's not necessary. Sometimes putting yourself in another person's shoe and being a little bit more empathetic, it really, really can make a lot of difference. But when we're always going in with this aggressiveness and anger towards a person or anger towards a situation, I don't see how we're helping the situation at all. So that is just my 2 cents on it. Um, we move as per usual. All right. Anyways, let me bring up my minister now, and then of course anybody else who needs to join will join. All right. So come on in, share the live, hit all you have to do is hit at highlight, at followers, and as many people as possible will be able to see and hear and be part of the conversation this morning. So we're not wasting any time. We're jumping right into it. I've got my minister here. Good morning, Minister Thomas. How are you today? Hold on, let me make sure. Hold on. Okay. Are you hearing me? Wait, it doesn't seem like she's hearing me. Hold on. Let me just check my settings quickly. All right, we seem to be good. Hold on 1 second. Background noise. All right, remove this, remove that. Microphone level. Okay, let me just check again. No, she's not muted on my end. No, she's on. She's not muted. So let me just make sure her volume is up. Let me just ask her to put up her volume. Turn up your volume. Yeah, so yeah, I'm just seeing so many of you just going absolutely crazy. See my mouth moving. It's up. And you have a nice yourself for the room. um okay. She says she's seeing my mouth moving, but she's not hearing me. And we did a test before and it was fine, so I'm not sure what's going on now. That's why I like them up in the ministry. It's always something up there with proper connection. Hold on, guys, just give me 1 second. Let me just call her and just make sure that because we did a test before and it worked just fine. So in the meantime, you can share. Naya, I want to mute you for the rest of the show, okay? All right. At all through the Okay, let's try this again. Let's see if you can hear me through hold on, let me put you up and then we'll try again. You hear me on the phone? Okay, so then I guess as much you could probably have to put your phone down, just rest your phone down and listen to me on the phone because I don't have the time to go through and look for IT at this time of the day, and that will probably take up all of the time. So let's just work with what we have. Once you're hearing me, we're seeing you, we're hearing you fine. So we'll have to work with that for now. Anyways, good morning and welcome back to the show. It's good to have you. How are you today?
Good morning to you and good morning to all your listeners. I am doing good.
Okay, and like I was saying before, of course, you are here in your capacity as the minister for mental health and wellness, right? And also, you've been part of some youth development initiatives I've seen. I think was at the Deluxe Cinema and at the Grenada Boys Secondary School. Plus, I'm sure there's other upcoming ones, so we want to talk about that.
We also had Wester Hall Secondary School last Sunday.
Okay, Wester Hall Secondary School. So I missed that one. All right. So, I was talking about mental health not so long ago. And, this is something that you have been very open about. You have experienced, some of the things surrounding mental health. And one of the things I really appreciate and admire about you is that you don't hide it. You've brought it out into the public. And now you being the Minister of Mental Health and Wellness, to me, it's right where you belong because of your experiences with it. You're in a better position to deal with it. So based on that, since you've been in the ministry, can you speak to us as to where we are now in terms of mental health? Because that is something that was developed specifically to deal with because it was part of another, but now you have a sole ministry designed to deal with that. So maybe you can tell us what's been going on at that ministry from since you started.
So first of all, I want to applaud the Prime Minister and the government for prioritizing mental health, for putting it at the forefront. Because as you know, Aruna, mental health in Grenada and maybe in the region and maybe even in the wider world is taboo. People I'm afraid to speak about the issues as it relates to mental health. And the truth about mental health is that without mental health, there's no health at all for every one of us. So whether or not you like me, whose mother is mentally challenged, or you do not have any family history, there's some point in your life when you may have some mental issues because you are human. And so you confront with different issues, a family member dead, then it challenge you mentally because it speaks about your mind. You will lose your job or something like that, and there's those challenges. There's depression and those other issues. So I am happy that we are able as a government to bring it to the fore so that the whole issue of stigma, the issue of discrimination can be addressed. And so we have started in January as a new ministry and developing terms of reference and all that because it's new. Yes, mental health, we have a mental institution, but really and truly, there weren't a lot about talk about mental health unless somebody commits suicide before, or unless there are some person who's challenged committed a crime or something like that. That's when you hear about it. So we are bringing it to the fore in terms of even our strategies and prioritizing how we deal and address the issue of mental health. And so we have done a number of things from the standpoint as a new ministry, a number of training for staff and the frontline staff, which is those who are in the level of the community, because we have to appreciate that we cannot only speak about Monge Mental Hospital, because mental health is everywhere and mental issues are everywhere. And therefore, we must be able to deal with it at the level of the community. Because those people who are admitted at Monge Mental Hospital, they come from the community. And therefore, our programs must address families. It must address communities. And so we had training with first responders, which is the police, which is the nurses who deals with, and nurses as a whole, because even if you're in the clinic dealing with primary care, then you will encounter people with mental challenges. And so we started with those particular training. We had a number of interventions at the schools. So with that's something we started and will continue in terms of providing those awareness at the school. So we did some school in St. George's, I believe, and we had Grenville Secondary School to either was done or to be done, and the other schools in St. Andrew and across Grenada. So what you'll see in the next month and even in the new year would be a lot of intervention at the level of the community and training. We have also trained faith-based organizations. So we had a whole massive training for people who are involved, so leaders in the faith-based organization, appreciating that as we go to church, and when we have challenges, we go to the pastor, we go to elders, and so seeking support, seeking them to pray for us and all that. So we wanted to provide them with particular training. What are you looking for? What, how do you know if this person need more than just talk? And so we provided that is continuous, and I think very soon, either next week, I do not have the data at the tip of my finger, we'll have some additional training for the faith-based, the nurses. So we continuous training. For and even in mental health, continuous training. We have our community health nurses out in the field, and for the month of mental health last month, they reported that there's a drop in the amount of admittance. So that speaks to the intervention at the level of the community. So I want to congratulate our community health nurses who are out in the field, out in the different parishes, putting their lives at a risk at times, because when you are dealing with people who are challenged, they can hit you, they can harm you, and so I want to congratulate them for their hard work, for their dedication, and to say to them that as a government we are committed to continue working with them. We are committed to providing the high standard for nurses.
So, and, you spoke about the Mount Gay Hospital. What is presently is the what's going on at Mount Gay in terms of? I know we spoke about doing some development, etc. What is the current state at of the Mount Gay Hospital?
So if I'm not sure how long you visit Mount Gay Hospital, but
it's been a while.
Is a place that need real renovation. I mean, the truth is, it seems like for years nothing wasn't done there, and so we are in the process of budgeting, and so we'll do Radun, which is supposed to be at the general hospital. That was the first contact. I think that was something happened. I think it was hurricane or so, and it was destroyed, and so that place will be repaired, and so the Radun will go back to that place in general hospital in sometime in the new year after all the renovation work is done, and then we'll look to repair block by block at Monge, because every block in Monge Mental Hospital need our assistance, need immediate attention, and so we have not done any major infrastructural work there since I came in January. We have presently we are doing the fencing. A new fencing, a contract was awarded for new fencing. We purchased new mattresses. In fact, from the government standpoint, we purchased about 80. I took the cabinet there to Monge because I wanted
to see, to have a first-hand
look. An appreciation what I'm talking about. You see, when you see and you feel what others are talking and seeing, then you give a better appreciation. You will provide the support that is necessary. When I come with a submission seeking financial assistance, then everybody will support. And so when the team went there, at the end, everyone decided that they too will purchase a mattress, and so that was done. They gave the monies, and we purchased it from Dean Mattress. We have ordered a number of beds that is fit for purpose that we are hoping that we will see in Grenada by the end of this year, because we are hoping to outfit, provide real comfort for these patients.
Yeah, that was my concern.
The care that they deserve. We also had, when we came in, we were told that there were sometimes issues with shortage of medication, and the PS and I intervened together and said that we want to make sure that we will procure long before. And just yesterday they raised that there are some other challenges when patients come to the outpatient clinic, and so I said we'll have this conversation to discuss how we provide those necessary support for those patients so that they can get the medication they can reintegrate it into the population and have meaningful life. Because the truth is, they are human beings who can live meaningful lives
given
if
the
they
proper
take the
care.
medication. Yes.
Because I've had a reason I ask is that I had a family member who said, listen, I went to visit a family member at Monge and I left depressed. And you're thinking you're going there to see your family member being taken care of and getting the best treatment. And, just like the state of the whole, it's the whole environment is not conducive to, fixing or helping your mental health to get to some stable place. And she was like, I left the depressed and I'm not even sure I'm going to go back because, just seeing how they are, it really, we need to do some work, to either do a facelift to make it more conducive to the development and to getting better. And not just see it as, because we have this stigma among gays concerned. It's like for crazy people. It's like for people that have no hope. There's nothing you can do for them. Nothing you can do. Just leave them there, and somewhere that the family don't have to deal with them, and you just put them there and forget about them. But I really hope that we can get to making it somewhere like it's a rehabilitation. Somewhere that you can go to and get the help that you need in an environment that is suitable for that purpose.
And that's our agenda. And as you talk about rehabilitation, so you will be aware that we had a Carlton home that was destroyed 20 years ago after the advent of Hurricane Ivan. So there's no real rehabilitation center when we speak about drugs and alcohol abuse. So there's nothing as we speak. However, I want to assure you and the general public that we are working assiduously to ensure that we bring back a rehabilitation center. It's not going to be Carlton House because that building will be in St. Andrew, close to the Maribor Hospital.
Okay.
Within all
that's a really nice,
hostel.
Quiet area as well.
Quiet area. So what we have, and you may ask, what have you done in anticipation or to prepare for that new initiative? Because the truth is, one of the reasons why we saw overcrowding in Monge Hospital when people with drug abuse issue, because there's no rehabilitation center, these people are also brought to Monge. When people have alcohol issues and maybe they have a particular challenge that seems mental, they are also brought to Monge. So there are periods when you have overcrowding and in the past you may hear that you don't even have enough beds. And that's because we have not cater for the different
types of and mental. So someone was just making that point. Nikisha is saying some patients don't need to go to Monge. Counseling and therapy can go a long way instead of taking them to the Monge hospital. Another person saying, my thoughts are, what about those persons who struggle on a day-to-day basis with these problems but do not need to be facilitated or locked up in hospital for treatment? What do we have in place for those persons who can't afford top-notch care on their own?
So and those are the discussions that we are having with the diaspora, so that we can have an online mechanism, so you can call. Because the truth is, even when you have challenge, even when families are seeing that there are some concerns, they find it difficult to seek particular, because we're small and because we talk a lot. And sometimes confidentiality becomes an issue. So you keep it to yourself until you get out of control. So we are hoping that we can put those mechanisms in place where you feel depressed, you can call someone. They don't know you, because most of these people who are willing to provide the necessary support, they are not living in Grenada. What they will see, maybe your face or your voice on the telephone or through some mechanism that we are hoping that we can unveil in the new year. And you can call and you can seek that particular support. And the truth, according to the person who on your life, not everyone need to be at Monge. Not everybody. Sometimes you have a challenge that all you need is somebody to talk to, somebody to counsel you, somebody. So sometimes you get frustrated and depressed because you lose your job. The truth is, taking you to Monge ain't gonna fix the issue. What you need is a job back. You have a member of a family died suddenly. What you need is to go through the grieving process
support,
with the assistance of people telling you that everything will be okay and guiding you. So we are hoping that we can roll out those particular interventions that will provide the necessary support for young people, because some of the challenges, most of our young people, a lot of our young people, they have challenges and they need our support. And so, as part of what we'll talk about when it comes to youth development, we'll have that particular care that will provide that necessary support there for young people. So all those things will be rolled out at different levels for different for the whole issue of mental health challenges.
I have
And
a couple
also, I was thinking
questions
about
here. Just stick a pin for a while. Someone here is saying that counseling needs to be more accessible. In terms of from the ministry perspective, how many counselors do we have? Trained therapists, psychologists do we have on staff? Are there enough to service the needs of our people?
So they are not enough, and that's why right now we are, just last week we had a sit down with DPA looking at our manpower need, appreciating that this is a new ministry, appreciating that we have social development, where you have a number of trained counselors there and who are doing their particular jobs, but we must appreciate that we need more in terms of counseling, we need more in terms of trained therapists and all that. So these are things that we are working to get, because we do not have most of them on island. You have some, but you do not have most. But we have the commitment from the diaspora that they are willing to provide those necessary support. So we will work with them to develop that mechanism so we can provide all the training, and everything not going to happen overnight. You have to appreciate that we are coming from nowhere and going to somewhere, and not knowing every aspect of it, because the truth is we have counselors at the Ministry of Social Development and we have counselors at the hospital, but just not enough to deal with the issues that confront us. And even the follow-up is something that is also needed. And so we'll do what it takes, put the resources in to ensure that we can provide the necessary support.
Well, I'm seeing commitments from the folks online, especially those in the diaspora, say they're ready to be part of that program. So how can they be part of it? What do they need to do?
So we have a Grenada diaspora advisory at maybe, let me see, is it GDAC? So that has been working with us as government and has been working with the ministry. A number of counselors, a number of trainers, a number of people in mental health experts. They have reached out to us, and they are the ones who have been providing most of the training I spoke to you about earlier. So we have that in place already, and we have people who normally comes after burial. We had a number of people who came, they went to Carriacou, they did distressors with our staff at the hospital and all that. So we have some mechanism in place. They can reach out to us, and so the more the merrier, because we know that a lot of Grenadians have the expertise. They are not in Grenada at present, but they are willing to provide support to us, and so we are willing to accept those necessary support because it's urgent.
It's super important because, we're dealing with so much lately, and, it seems as though capabilities when it comes to coping or coping mechanisms, they seem to be very, very far, and I really think that is something that we need to place emphasis on, because without your people being in a good state of mind, we can speak all the development we want, we can speak, but if our people are not on that level, it will be all in vain. So we have to make sure that people get the necessary care and support that they need. And I'm so happy that we have a ministry dedicated to that and not joined with something else that is like by the way, but we can really, really put the work in to make sure that people get the help they need. Another question though that I'm seeing from the chat, someone is asking, what type of health laws are you going to implement in terms of confidentiality? Because that is a problem.
So I cannot tell you for now that we have started looking at laws for confidentiality. I know that we are looking at the whole policy, and you're right. There must be some confidentiality clause, and I believe that there are. But you're dealing with human beings, and so we have to be able to get people who appreciate that when someone come to you, you are professional, and you should act in that particular way. So these are issues that we have to look into. But if I say to you that we already develop a policy or some laws, then I'll be dishonest, and I do not want to be dishonest to you
Okay,
on
great.
that particular issue, but it's something that I'll take note of.
Appreciated. Another comment says young parents need parental guidance, and that is very important. Raising children is quite challenging with all the stimulus that is so easily accessible. We are living in different times and are ill-equipped, and I think that is something the focus needs to be put on a lot. Parenting, young parents especially, and coping and how to deal with it. Because I'm sure I've gotten reports of children being abused based on frustration from not knowing how to deal with it. Sometimes single parent, no fathers around to assist, and that can be very, very challenging on a young woman. So what do we have in place? Because we're talking, let's get to the youth part of it now.
So the parenting you're talking about it falls under a different ministry. The Ministry of Social Development, they deals with parenting. In fact, next week Tuesday, I know they're launching a parenting program in Moncton, where I live in my village, and I know that they have a number of other parenting programs in different parish and so. But I cannot speak to that particular issue now.
But is that something that we can look at in the future in terms of merging some sort of the mental health and young parenting guidelines?
So we can take note of this, and I can raise it with the minister and her team in the ministry. But they are aware that there is this need for parenting, and so they are putting on particular programs. But maybe there need to be a lot more. But they are doing a lot from the Ministry of Social Development as it relates to that.
Okay, I'm seeing a question here. Grenada has a high rate of mental health disorders, including depression, anxiety, and substance abuse. The mental health infrastructure in Grenada is limited, and there are few resources available for those who need help. Some of the most pressing mental health concerns in Grenada include the lack of access to mental health services, the stigma surrounding mental illness, and the high rates of suicide. How are we going to deal with that?
So that person hit it bang on some of the challenges. I believe that some of the things that I addressed earlier is some of the ways that we are dealing with it. The fact that we are progressing to have a rehabilitation center for drug and alcohol abuse, and we already had the land surveyed in September. We're hoping to see by the end of November that the site is cleared, preparing to start construction. I know that the Ministry of Works is finalizing the designs and the costing so that it will be in the budget. But that would not be an overnight project that happens in 6 to 8 months. So it means that you must have some stopgap measures to deal with the issues that confront people using alcohol and drugs before we get to really having that facility with trained staff, with toxicologists and all that. So I believe that we are in the right place at this time in terms of putting those programs in place and being able to implement the programs to provide the necessary assistance that
I think that is one of the problems that confronts us. Implementation. We have these things on paper. We have these programs lined up, but implementing them and make sure that they get off the ground and they proceed at a good rate seems to be an issue sometimes. So that's something we probably need to work on some more. And I'm seeing another great comment here in terms of where is it? Okay, so do they also deal with aspects of postpartum depression, after pregnancy, psychosis, etc.? All these are part of some of the things that contribute to mental illness and depression. Postpartum depression is very real. And someone is also saying there are no proper diagnosis centers. So, how do we pronounce somebody to be mentally challenged or bipolar or having postpartum depression? Do they go to a medical doctor, or do we take them directly to Monge Hospital?
So they do go to the doctor, to particular clinics or doctors first, and then the referral will come from the doctors first. So you don't just pick up somebody and drop them in Monge. So even if there's an issue, a challenge, the police cannot just pick you up unless they just cannot pick you up and not bringing you to see a doctor that will give the referral. So in terms of diagnosing, it must come from the medical expert. Because normally a lot of people call me as Minister of Mental Health, hoping that I can send somebody to take their families to Monge, but it doesn't happen that way. I'm the policy maker, so I cannot make a decision on to pick up someone and bring them to Monge. What I will advise is to get them to see the doctor, and so the doctor will guide. So either they take them to the hospital or to some private doctor that will provide that guidance. And we do have specialists. We need more than what we have at this time, but we do have those who will be able to. We have a Cuban at present. We have Dr. His name is not coming right now. That we contracted earlier on this year. That is assisting us at the level of the community. He's in Monge and even at the hospital. So that's someone who's in Grenada, who lives in Grenada, apart from the Cuban. And so we know that we need more than just what we have now, but we will be working to get more people on board. And more than that, we also will be providing the necessary assistance for training. So training more mental health nurses. We sent one for training in the period that when we just came in. We are looking to put into our budget and for more of our nurses, and I did have a discussion with them so that on a yearly basis we can ensure that we get those who are already in the system trained, but new persons who are interested in that field to be trained also. And we need more mental health doctors. We need our local doctors to specialize in mental health, and so it will be our priority in terms of even providing scholarships for our people who are
so we can get some therapists and counselors and psychotherapists, etc. That would be extremely important, because from what I've gathered from you, your ministry have identified a lot of the issues, identified a lot of the problems. So basically what we're looking at now is implementation, putting some of those things, the issues that you've identified, finding the solutions, and of course, implementing them. That is what that seems to be where we're at now, implementation and enforcing some of the laws and regulations surrounding mental health. Again, this is where laws come into play, someone says, because people who are experiencing substance abuse don't check themselves in for care. So what legal framework is available for families to intervene?
So I cannot speak to any legal framework at this point. I'm not saying there isn't. I'm not saying there is, but I do not have that information from where I speak now. But as we work within the next couple of months to build that facility, it means that while we build, we have to be looking at staff. We have to be looking at our policies, our legislation, and all those issues. So that will be part of the bigger agenda as it relates to rehabilitation, as it relates to drug abuse, and So the fact that we had a Carlton House before, it means that there may be something in the works. Some of our laws are outdated, like for example, where suicide is a crime, is something that we are discussing, something we have to look at, and how we better deal with those people with mental challenges. So the laws, the policies, these are things that will be part of our developmental agenda in the next in the new year.
Now we have a couple
of assessment. We had when we started, we had the Canadian. He's a senator. He's a doctor. He's an expert in mental health. He came down and he did all the assessments for us. So we know what must be done. We have had discussion about a month ago with PAHO, because we are seeking collaboration and partnership. We are seeking assistance financially and otherwise, so that we can give our people the best care that they need.
So then we need to, like I said, we need to really, light some fire under it and, make sure those things are implemented at a faster rate. Now, you mentioned, of course, we don't have enough counselors, therapists, etc. And prior to that, you also spoke about, the youth development programs that's going on, that you've been in the different, you've been in Wester Hall, you've been at Deluxe Cinema, you've been at the Grenada Boys Secondary School. Maybe that's something that can be discussed as well, in terms of, because, the career choices seems to be doctor, lawyer, along those lines. And we sometimes forget that, hey, being a therapist, a counselor, physiotherapist, all those things are also careers that can be looked at. And if we have a shortage of them, maybe we can, create some incentives to make young people interested in it, so that they can at least earn, something, a good income from it, as well as have a good career in it. Is that sort of what is the discussion surrounding these
Yes.
engagements?
So that was one that came up, and there was this young lady, maybe early 20s, who was passionate about working in mental health, and being trained. And so the issue of mental health came up a lot at those group sessions, because in St. Davis, we took a different format. You said you didn't see. So in St. Davis, we did not have just that open house where we speak and then we gave them chance to ask questions. We had groups, different groups, where in each group you had a minister, and the young people had more time to speak. So they speak to us, they identify what the challenges are. And so mental health came up, but the issue of training, there were more than one person who interested in being trained, who interested in going and further education, and very passionate about those issues. And so these are the areas that, in terms of our youth developmental agenda, in terms of providing scholarships, in terms of providing things, this will form part of the bigger picture in terms of what our policy agenda is as a government. So those forums that you're talking about will take into consideration those issues raised by the young people. So the developmental agenda would not be an NDC government with ministers sat in a cabinet or sat in some office and decide these are the issues that confront young people, and so we're going to give A, B, C, and D. What we have done and we are doing over the next couple of weeks is engage young people, not only from those forums, because we also will be them at the top, because everyone will not come out in the forums. So we'll also meet them on the block, in the schools, and all that, so we can hear from them. What are your challenges? What are the challenges? What are you interested in? It's not no longer like before. When you meet young people, they say, well, I want to be a teacher, doctor, or nurse. There are so many other fields. And so what support are you going to provide as a government to ensure that we get less people wanting to come and say they need a job in the government, because they can provide either be trained and find jobs elsewhere, or they can make their own jobs. And those are the issues that are coming up. The issue of youth in agriculture came up so in St. Andrew. It was, well, Aruna, St. Andrew is the breadbasket of Grenada. But we were so pleased to hear so many young people, and the number of young men must be commended for not only coming out. They didn't come out and sit down. They came out,
they were engaged,
and they raised their issues. And so that will drive our developmental agenda, our youth agenda. It will help us to roll out the policies that is youth-centered. So we listen to their voice. It's their voice. We give them that safe space. And it's not a safe space to just talk and then empty talk. It's a safe space that you talk, and then you realize that after you talk, those talk becomes what government has as its policy for young people.
So it's not just a sort of forum where we talk, and we go away, and nothing happens. Last thing before we go though too is that of you mentioned having training and making scholarships available for young people who are interested in those fields. But one of the things that I realized too is that due to proper compensation, a lot of the times they get these scholarships and they do not return, and then you're developing another country where there's a huge need for those sort of services, therapists, counseling services. It's because you're dealing with millions of people, and of course they go through life like everybody else. So they rather remain there and make their career and be compensated properly. And if we're going to do that, I hope it's going to be something where that will encourage them to come back to serve, and if for whatever years they choose to leave, that's on them. But making sure that they come back to serve at least a couple of years, well, to sort of deal with the scholarship part of it. Your thoughts on that before we go?
So there is always the bonding aspect where you sign the bond so that you must come back to serve for a particular period. But we must appreciate that those fields are highly needed all over the world, and they are highly paid. So as a government, we must look at ways and means to compensate our people better so that they would stay. Not everyone that want to leave, some will leave, but if you provide that avenue, that mechanism where you pay better in those skill areas, but in all areas, then we'll be able to keep. And this is a question, a discussion that I think we already started, and it's one that we have to continue to ensure that yes, you provide the training, but these people are going and study for a lot of years, and so they want to be properly compensated so that they can take care of themselves and their families. And so we have to be able to put particular structures in place that will provide for those compensation.
Oh, I wish we had more time to continue, but of course, like I said to you, you're always welcome. So we can, do this because there's so much to talk about. Just try to broaden it today to give people an understanding of what the ministry is about and what to look for. So we definitely need to do a follow up. But is there any upcoming youth engagement soon?
So I want to say to you that we are going to have 1 month of youth activity starting from November 1st, which is Friday.
Mm-hmm.
So Friday, I have already recorded a message to be aired to commence the month of November Youth Month. And that same evening, we have a Thanksgiving service and gospel concert at the Brudge New Testament Church of God. So you are invited, Aruna.
Yeah, been a while.
You're in public. You can come and be blessed. Mm-hmm. And then we have a number of activities. We'll have some community volunteer initiative, one of those weekends where in every parish you'll have youth coming out and being involved in some level of community engagement, not about cleaning only, but any engagement they deem necessary in the particular space. So they will be involved in that. There's one of the days that I will say Orange Day, where young people should wear orange. Let me see, what else do we have? We do have an award, but we'll climax with what we award, or not award, but a recognition.
Okay.
The youth recognition and rally, a youth rally. And that youth rally, so we are going around in every parish as we speak, dealing with the issues that confront youth. And so it means that we are in the process of also developing our youth agenda, our youth policy. And so that will roll out what we hope to do for a period of time for young people. And that will be rolled out. So it will be, they will be hearing what they gave us, being put into a policy paper, that not only a paper, but will be part of our budget that will finance and be able to roll out in terms of youth training, leadership training, which we already started. We had one in St. George's. The next one will be on the 9th and 10th in St. Andrews. So we'll have different those leadership training for young people. Then we'll have additional training for young people. There are lots of young people, and the NDC manifesto speaks to that. That will provide that level of training for people who drop out from secondary school, who didn't finish secondary school, who didn't finish TAMCC, or didn't have a chance to go to TAMCC. And so that will be provided with it speaks to reimagining the Imani program. And the Imani program have done a lot. A lot of people can say that because of the Imani program, I am where I am. But there are hundreds that are saying that it is 7, 5, 6, 10 years in some instances that I'm part of a training program. In some instances, these people are involved in the private sector. So government paying you more than 7 years in a private sector place. Government is paying you to be working outside of the government sector. And we are saying these loopholes must stop. Mm-hmm. So while we appreciate that there are a lot of people become teachers, kudos to them. Just recently, we have a number of trainees who are exiting because they are now teachers, they find jobs elsewhere. But we are saying that the issue of being in a training program for more than 2 years cannot continue. And so we'll look at our programs. Mm-hmm. We'll provide the training, we'll provide the scholarships, but there will be an exit strategy. There will be permanent job engagement in terms of we have a cyber security, we'll have programs for female. We continue the Empower program because we believe that it is important, to engage young men, young at-risk men, and so it was a program from the former administration, but you must appreciate that government is continuing,
Yes,
and
got
there
you.
are issues that is bigger than us. So we politicians, and we are from a different, I think, but we as a government realize and appreciate that our responsibility is to the people. And if something is good, there's no thing of throwing it out the door. So we'll continue with those issues, those areas that are good, and we'll try to see how we can deal with some of the loopholes in the system, but still provide the necessary training that our young people so need and so deserve from the government.
Thank you so much, Minister Thomas. It was an absolute pleasure having you on this morning. Don't be a stranger. Looking forward to having you again soon. It's been too long, almost how many months? So let's hope we can do some catching up soon, because there's a lot that you said that we need to elaborate on. So I hope you will join me again.
Sometime in November, because it's youth month, I will come back to talk to you. And then after we would have rolled out our youth policy and youth agenda, then we can flesh out how the implementation will be, because we are hoping that as bang January we are able to start to engage
hit the ground running.
Some of our entrepreneurship and other programs for young people.
Got you. Thank you so very much. It was an absolute pleasure. Nurse Sarana, good morning. Sending her love as always. Hope you have a good one. Minister, hope you have a good day. Thank you so very much for accommodating me this morning, and I look forward to speaking with you again in November. So we'll keep in touch.
Always a pleasure to talk to you. So take care. Enjoy your lunch.
All right. Have a good one. You too.
Bye-bye.
Bye-bye. Yeah. And that's just about it for our program. We went way beyond, but of course there was so much information to disseminate. We had to, and there's many other things we still have not touched in terms of, mental health and what contributes to it and how are we dealing. And Hugh, I just saw you mention marijuana and alcohol consumption. That is a conversation we need to have as well. To everybody who stayed and participated this morning, I see you. I appreciate you. You're not only here for the old talk, but you're here for the serious talk. Thank you so very much for being here. And I'll see you guys tomorrow, same time, same place for another one. Until then, stay powered up and have yourselves a great Wednesday.